We noticed a dramatic decline in the number of patients that we were caring for, and we were wondering what that might be, and that led us to the conclusion that it may actually be related to the recession, and we decided to analyze that through the study that we conducted. Well, first we looked at all cancers, but since we thought that there may be a different effect depending on the type of cancer, we selected two different cancers. We looked at breast cancer and pancreatic cancer. And the reason we did that is we chose one cancer in which there is a screening test that is recommended, but we could envision patients or people deciding to forego because of economic hardship, loss of insurance, loss of job, time pressures, etc., that would be occurring during a recession. And as well as a cancer that presents with relatively mild symptoms in many situations, which again would be more easily deferred by a person who was under economic stress. And breast cancer fits that well because it both has a screening test and often presents with a lump in the breast without any other symptom. And compared that to pancreatic cancer, which there's no screening test for and which generally presents with fairly severe symptoms, which would be much less likely for people to avoid. So we found that for all cancer, there was a significant decrease in the number of patients being diagnosed and treated with both radiation and surgery during times of higher unemployment. For every 1% increase in unemployment, there was an over 2% decrease in the diagnosis of cancer and higher percentages of patients not treated with surgery or radiation during those time frames. And when we looked further, we indeed found what we thought we might find. In breast cancer, there was a very profound effect on increasing unemployment, with higher unemployment leading to decreasing diagnosis and treatment of breast cancer, and that this difference, or this amount, is much greater than what we saw with pancreatic cancer. So for every 1% increase in unemployment, there was approximately a 8% decline in breast cancer diagnosis, a 16% decline in surgery for breast cancer, in radiation for breast cancer, and a 24% decline in the use of surgery for breast cancer. Well, I think it really raises a lot of very important questions. It clearly means, first of all, that having a healthy economy is not just important for our financial well-being, but also for our health and our cancer well-being. But in terms of public policy, it does raise questions about how to take care of people during a time of a recession. Is there anything we can do to help people during these times so that their cancer can be appropriately dealt with? It also leads to an education point, I think, for the public at large to understand that even if you're economically challenged, ignoring problems could have severe consequences.